Hi there, my name is Kristen. I am the Volunteer Engagement Manager with 365 Health. So first I want to say thank you for volunteering at your local community health fair. This is a resource that goes across the state and provides so many with access to preventive health resources. So thank you for getting involved in the health fair. So if you're watching this video, you are volunteering for what we call the checkout station. So typically this station is towards the exit area of the health fair. So you should be one of the last volunteers they see before they're exiting and leaving the health fair space. So this station can have a few components, but the main purpose of you, the volunteer who's at the station, is to ensure that one, everyone gets a wave by, right, before they leave the health fair. They see a friendly face before they leave, just to wrap up that whole health fair experience. So make sure to, interact with the participants that are walking past you. Make sure you just review quickly the short protocol for your station as well. Those are available for every volunteer position at a health fair. But ultimately, one of the critical aspects of this station is to ensure that no participant leaves the health fair with a lab copy of their registration form, whether it's online, on-site registration form. They are not to leave the health fair premises with a lab copy. Whether or not they got blood work done, some folks don't. Some folks come to the health fair and they want to take advantage of all the free offerings. We welcome that, but we want to still be able to track the number of participants that are flowing through the health fair for the 4 or 5 or however many hours of the health fair there is. So I would like you to be diligent about what you're looking at when participants are coming towards you to exit the health fair. So like I stated, there are on-site registration forms and online registration forms. So they look a little different. One is like a carbon copy with these little tabby things on the end, and then this one is printed from home or printed here at the fair. So this top copy here, you can see this top copy is what the lab copy looks like. So I think the biggest indicator is that this giant yellow section. If you're seeing someone walk around with a sheet that looks like this with a bunch of yellow highlights and all this text down here, you just want to make sure to just, very nicely just say, hi, how you doing? Oh, hey, can I see that really quick? Just take a glance at it. I just need to take this lab copy for our records, but don't worry, I'm going to leave you with the participant copy with your receipt, so that way they can leave with that. So this back copy is what participants should be leaving with. Just so you know, I know in this video, this sheet is yellow. Starting spring 2023, this back sheet, the participant copy, is now white. But it will look the same, and the biggest indicator to let you know that it's a participant copy is the back. It lists all of the optional health screenings that can be available at a health fair. So medical screeners have gone around and written their results on the back sheet. So we want to make sure they can leave with this copy, but they should, and I repeat, should not be leaving with the white lab copy, or I forgot to mention the green cashier copy. This should have been taken before they left the registration area. For the online registration paperwork, the lab copy, it just has this like giant gray box that says lab copy, and the participant copy is much like the on-site registration form. It has a giant box down here with all of the listed optional screenings. That way they can leave with information about what they learned about their health today. So participants only keep participant copies. Lab copies, cashier copies, you take if participants happen to be walking around with them and you see it. Beyond that aspect of your station, there could be a couple different things that you are asked to do as the checkout volunteer. Sometimes we want to learn a little bit more about how participants heard about the health fair. So some sites, they might have you pull up a survey on your phone and just ask people, and you can just go ahead and click and submit each one as they go. Some sites are a little bit more analog and might have it just like written down, just do some tallies on where they heard about us. Whatever way that your fair is doing it, go ahead and complete it that way. Another aspect to this area is the 365 Health staff member might put a sign at your station about a text to give. So 365 Health is a 501c3 nonprofit, and we rely on the generosity of so many to keep our work going and growing and thriving in the community. So if you're having a conversation with a participant, just let them know this is here. There's a QR code they can scan. It's super easy if they do decide that they want to give us a donation. Definitely not required, but always appreciated. The last aspect that might be asked of you at the checkout station, typically we have these little slips for people to write down a testimonial, whether it's about their experience today, or maybe they've been a long-time health fair participant and we help them detect something, or maybe it's just every time they come to a health fair all the volunteers are amazing and they want to tell the public about it. So encourage participants, if they have a moment to spare, to write down a short testimonial. They can let us know who they are, or they can write it anonymously. So that is it for the checkout station. Thank you for watching, and thank you for donating your time.